House Bill 1362. Mr. Secretary.
House Bill number 1362 has a fiscal note, a bill for an act to create and enact a new section to a chapter of the code relating to Medicaid expansion, to provide an appropriation to the Department of Human Services for the expansion of the medical assistant program, to provide for a legislative management study, to provide an effective date, and to provide an expiration date. The fiscal note for the 2013-15 biennium under general funds, expenditures and appropriations are both $248,000. Under other funds, revenues, expenditures and appropriation, all three are $154.7 million. For the 2015-17 biennium, under general funds, expenditures and appropriations are both $2.8 million. Under other funds, revenues, expenditures, and appropriations, all three are $213.7 million.
Senator Judy Lee.
Mr. President, House Bill 1362 deals with the expansion of Medicaid, as has just been stated, and that, of course, is our country's coverage for low-income people, including low-income parents with children, pregnant women, low-income Medicare beneficiaries, and people with disabilities. Excuse me, many have special needs because of the coverage that is provided for disabled and medically needy people. The Personal Protection and Affordable Care Act, which I will call PPACA from now on, originally required that states expand medical assistance, which is called Medicaid, coverage to everyone up to 133% of poverty plus 5% disregard. So it's a total of 138%. So that's a number we're going to be talking about as well. On June 28th of last year, the Supreme Court upheld the expansion but struck down the mandate, saying that the federal government could not withhold all federal funding for current Medicaid programs in order to require the states to expand Medicaid, but instead left the decisions to the states. The expansion covers only people who are not covered at all at this time, and that would be childless adults between the ages of 19 and 65, up to 138% of poverty. And if you take a look at that green chart, Mr. President and members of the body, you will see the various percentages of poverty for the various medical programs that we have, all various medical eligibility. And the one we're going to be focusing on is the yellow column, because that's the 138%. And that shows what the maximum monthly income is for households of those various sizes. As you can see, the number for a single person is $15,420 a year. Two people is $20,880, and so forth. A family of four, $31,812 for the year. Under the insurance exchange, there are 4 levels of policies: bronze, silver, gold, and platinum. And the bronze policy is likely to cost around $4,000 a year. That would be impossible for someone to pay who is making $15,000 a year. And that person is one of those who would be covered under Medicaid expansion. Those from 100, if we go to the arrow chart, Mr. President, if you go to the arrow chart, you will see that on the top level, that orange one says there is an individual mandate required under current federal law now for individuals to have qualified or credible insurance. You can also see that the Medicaid expansion is available in the green bar for people from 0 to 138% of poverty. But in the purple one, you can see that the subsidies are available through the insurance exchange beginning at 100% of poverty and going on. So that blue box is a really important group. That blue box is that includes the group of folks from 0 to 100% of poverty who have no coverage anyplace. The reason for that is that the federal PPACA law assumed that the expansion would be mandated and every state would have it, and these individuals below 100% of poverty would have been covered by that required Medicaid expansion. So there is nothing for them in the exchange for subsidies of any sort. So the ones who are hit the worst by this whole situation right now are the people who are at the lowest incomes. The Department of Human Services estimates that about 20,500 people will qualify for the for coverage here. Excuse me, yes, based on census data, but it is impossible to know exactly or accurately how many will apply. There are 7,000 approximately from 100 to 138% of poverty, and they would be eligible to qualify for subsidies on the exchange, but again, those under 100% receive no benefits at all. Eligibility determination for medical assistance and for children's health insurance, as many of you are aware, currently is based on net income, and we have a significant number of deductions and disregards that lead us to the qualifying income. But PPACA requires that all of these programs use modified adjusted gross income, or MAGI, to determine eligibility. Whether we like it or not, it's the law. There are 12 new taxes in PPACA, 18 new taxes in PPACA, all intended to help pay, among other things, for this expansion. North Dakota citizens will pay these taxes whether we pass 1362 or not. And we will also be paying higher premiums for health insurance coverage because of the requirements of this bill. I want to talk just a little bit about the exchange because that is a part of this discussion here. The group of newly eligible that are shown in that blue box, as I mentioned, are under 100% of poverty. But those who make 101 to 138% qualify for the exchange, and again, about 7,000 people. The maximum premium that someone up to 138% of the federal poverty level will pay is 2% of their gross income. So that means if somebody's making $16,000, they'd pay $320 a year for the premium. Excuse me. The feds are taxing all of us as citizens to pay for the exchange. Employers must provide insurance or pay penalties up to $3,000 per employee if they are not providing insurance. Excuse me, I'm switching gears here because this isn't scrolling well. Employees are also mandated to have insurance, and they will pay increasing penalties if they don't acquire it. Healthcare providers will receive lower reimbursements in order to support expansion, and poor adults will still have no coverage. Without the expansion, they will have less income, the providers I'm saying, and will still be providing charity care. The expansion is 100% federally funded in the first 3 years, declining to 90% by the year 2020. The state will provide the difference after the first 3 years. The Department of Human Services estimates $101 to $158 million in federal funding for 2013-15. You can see lots of details on the, that's per year, on the fiscal note. And I want to make sure that you understand also that this expansion is only for acute services. It does not cover long-term care or any of the services provided for people with developmental disabilities. Those who are currently eligible and who have not yet enrolled, because we have quite a few of those too, we just don't know exactly how many, are expected to enroll not only because of additional outreach that will be taking place through federal efforts, but because of the mandate. And as people file tax returns, they are going to be instructed that if they don't have insurance, that they do need to have it. And the cost of those people who are already eligible will be covered by our existing Medicaid program, because if they had come to apply, they would currently be covered. And that's at the 50-50 match, state and federal money. So the expansion we're talking about is just for those newly eligible. 5 facts about the uninsured population that I think are really important for us to keep in mind. Most have low or moderate income. More than 75% are in a working family. Medical assistance and children's health insurance programs cover many children, but the adults go bare. Often the kids are covered by these medical assistance programs, but their parents may not have coverage through their work, and so they have no coverage at all. About 25% go without needed care due to cost, compared to 4% who have private insurance. And medical bills often become a heavy debt burden for those who do not have coverage. The federal exchange is up and running as of March 25th of this year. We thought that it might not ever get up and going, but it is, and there are states already involved with it, and North Dakota eventually will be too. Not expanding Medicaid means that lower paid workers become the responsibility of their employers. Now I'm thinking about those folks who maybe work in a convenience store, or they might work bagging groceries or being checkout folks in the grocery store that are not making what truck drivers are making out in the oil patch. So there are a lot of folks who are still doing important work in North Dakota, but they're not working at high-paying jobs, and in many cases they are not working at jobs where health insurance is provided. Multi-state employers are also concerned about administrative issues that some states expand and others do not. We do need to keep in mind that this is in essence a one-time situation. In other words, if we delayed this by 2 years and said we're just going to wait and see what happens, we will lose 2 years of the 100% funding. We would have 1 remaining year, but it doesn't mean that we can start our clock 2 years down the road. I can find a lot not to like about PPACA. As I know is true of a lot of people in this room, there are also a fair number of folks who think that it's okay. I think it has a noble goal, but I think it is overreaching in so many ways, but it doesn't really matter what I think, because that's not what we're debating today. It's the law, and we have to figure out what's best for the citizens of North Dakota, whether we like it or not, is not relevant. But I do not want to go home and tell someone that if they're making $16,000, they can buy insurance for $320 a year, but if they're making $14,000, it's going to cost them $4,000. I don't want to tell North Dakota employers that they have to pay large penalties to cover low-wage employees or pay for health insurance under certain conditions. I don't want to tell employees and other individuals that they will have to pay penalties if they do not purchase insurance. I don't want to tell healthcare providers that they must continue to provide millions of dollars of uncompensated care, especially in our small rural hospitals where they have a higher percentage of patients in many cases that are getting medical assistance, because we are not insuring a large portion of their patients. Healthcare providers have told us, actually their data has told us, that nearly 70% of their uncompensated care is because of lack of insurance, and the rest of us are paying the difference one way or another. And we still would have 20,000 people with no health coverage. The expansion of Medicaid is 100% federally funded, as I mentioned, for the first 3 years. But North Dakota citizens are paying our taxes to fund it, even if we don't do the expansion. The Department of Human Services will provide expansion coverage by bidding through private carriers or using the exchange, as you will note in the bill itself. New enrollees will be informed that benefits may be reduced or eliminated if federal participation changes. The 90-10 reimbursement could change, for example, or the FMAP could change, as it has while I've been in this legislative body, from 72% down to the current 50%. We know those things are all possible. But I haven't heard anybody suggest that we forego taking the federal money that's currently provided for us, even with the 50-50 match under FMAP, and do all of our Medicaid and medical assistance funding with state money. We will study the programs of the expansion during the interim to see how it's working. There's a sunset in 4 years, so it'll definitely be reevaluated in 2017, and it is important to give it that much time in order to get everything up and running and have some data. I understand that it would be a very tough decision to end it at that time. But we are entrusted with the responsibility to make difficult decisions in the best interests of our state, and I think that's what we will need to do and to have to decide in the year 2017. We must keep in mind the best interests of employers, employees, healthcare providers, and citizens who are paying taxes and premiums, and certainly must keep in mind the 13,000 who are below the 100% level of poverty and still will not have any coverage if we do not pass 1362. The expansion of Medicaid will help keep North Dakota employers, employees, providers, and taxpayers on an even playing field with many other states. It is the right thing to do, and I do ask for your yes vote on House Bill 1362.
Further discussion? Senator Mathern.
Thank you, Mr. President and fellow senators. I ask us to consider the bright side of passing this bill. Today could be a good day for people who live in the shadows. Who are these people? They are the people that are working, who don't earn enough for a private health insurance plan, but they make too much for a public health plan. Often they work at tough jobs, or maybe many part-time jobs, but they're only in the shadow of an employer health care plan like you and I enjoy. They work for employers that don't offer a plan, or they have a plan with such high copays or premiums that they just cannot take part. So they are in the shadows. While these people are low income in their wages, they're also in the shadow of our public health plans. Unlike the very poor or the categorically eligible, they're not pregnant, they have some income, they have no handicap. But because of that, they're not eligible for these positive programs. I agree. The bill that we have before us is not perfect. It'll require the interim committee work and probably repair constantly. But the greater good, I believe, will be served by taking people out of the shadows. Mr. President and members of the Senate, passage of House Bill 1362 will finally be a good day for a new group of citizens who will be becoming participants in our positive health care system. I ask for a due pass on House Bill 1362.
Senator Dever.
I don't like it, Mr. President. PPACA, better known or more appropriately known as federal health care reform, passed under the misnomer of affordable care because it doesn't have anything to do with making care more affordable. I don't like it because when government tries to be everything to everybody, it exhausts all its resources and it loses sight of its original mission. And I don't like it, Mr. President, because Washington, who spent all the money and put us $17 trillion in debt, now finds the delivery of social services through private enterprises and still takes credit for it. I don't like it because of the way that it was passed. Our president took office in January of 2009 and immediately jumped on this issue and wanted Congress to pass it before they went home for their August recess. And when they didn't do that, they came home and found out that the people don't like it either. And that was his purpose, was to prevent them from hearing that. They didn't get it done before the August recess, so he kept them Christmas Eve of 2009 for the same reason. They finally passed it on Easter Sunday, March 23rd, 2010. And the people still don't like it. And I don't like it because this one provision, our only opportunity to protest the whole thing, is this one provision where the need is the greatest. If we were looking at a standalone program to expand Medicaid, and if we didn't have $17 trillion in debt, and if Congress had passed a budget in the last 4 years, a budget, even a deficit budget, but one that demonstrates the sustainability of this going forward, then I could support it. But Mr. President, the reason I support it is another reason I don't like it. One of the provisions that they included to pay for Medicaid expansion was a reduction in Medicare reimbursement. Sir Walter Scott said it best when he said, "Oh, the tangled webs we weave when we practice to deceive." So the federal government tied a reduction in reimbursements to our North Dakota healthcare providers to pay for Medicaid expansion. So if we don't adopt it, they lose that money, and they don't get that reimbursement. Mr. President, I'd love to use this bill to send a message to Washington, but Washington doesn't care what we think. Mr. President, we have 3 new members of Congress since this past 3 years ago, and I've always felt that people who go to Congress, when they get there, have their heart in the right place, and I think our 3 members do now. But I think the message we need to send to them is, if you don't change Washington, Washington will change you. So, Mr. President, one of the things I don't like about this is that I don't have any choice but to vote for it. So I'm going to vote for it, but I'm not going to like it.
Senator Bowman.
Yeah, Mr. President, I don't like it either, but it's for a lot of different reasons. I don't know if you took time to do a little research on this, but this comes from the Heartland Institution. This will only add about $800 billion more to our debt. $800 billion more. On an average, the states are going to have to spend about $21 billion from 2014 to 2019. Medicaid programs are already unsustainable. Everyone knows that. We have a lot of other programs in the government that are unsustainable. And the magic about this is they're going to give us 100%. Whose money is it? It's our money. If they're going to give us 100%, why did we give it to them in the first place? These are just things that you have to think about when you're getting involved in expansion of government. It sounds great. They've made it so that the states can't hardly turn it down. But lo and behold, as we watch that clock tick, and all of a sudden our credit drops, and our federal government goes broke, we can only blame ourselves if we want to pass this. So I'm voting no on it.
Senator Anderson.
Mr. President, I don't like it either, and I'm not going to vote for it. No one sent me here saying that if we could just cover single individuals up to 100% of poverty, we'd have our problem solved. No one sent me here to say that if we could expand Medicaid to 138% of poverty, we'd have our problem solved. Hospitals have unreimbursed care now, and I predict they'll continue to have unreimbursed care after today. Our insurance companies have told us that as a result of this, even though we're now paying for uncompensated care with our insurance premiums, they've said our insurance premiums aren't going to go down. They've said that they might not go up quite as fast. The feds will not change anything or back off as long as we say, give me the money and rub my tummy. So I'm going to vote no.
Senator Kilzer.
Well, Mr. President, I also will vote no on this, probably from a little bit different perspective. I agree with my predecessors in speaking about the difficulties with government medicine, and I've dealt with that for 40 years, particularly in the VA system and the Indian Health Service. And if you want to know what this might look like with our complete socialized medicine within a few years, just take a look at those two programs. I do want to take a moment to talk about the finances, the cost shifting that occurs. Why do you think the hospital, especially the critical access hospital people, are around here asking for more money? It's because of government programs like this that cost shift to the rest of us. And if you ask your plan manager or your employer how much of your premium every month goes to cost shifting, it's a significant amount. And I would certainly urge you to keep that in mind. What is the history of Medicaid when they haven't been able to pay their bills? And I've been through this as a provider in the past. Number one, they just cut providers, expect them to do more cost shifting. Number two, they'll reduce benefits. Durable medical equipment is usually the first to go. But there are others. The more the federal government runs out of money, the more you'll see that. This is quite a carrot, this 100% coverage for the first 3 years. It's kind of reminiscent of the way our president got us into this whole mess. You remember the Nebraska Cornhusker deal, the Louisiana Purchase, the Florida Medicare? Even in our own area, it was the Frontier Amendment that lured the providers into it. and they're not so happy because that may be off the table pretty rapidly. But it's kind of interesting also that the bill prior to this, the nursing home bill, showed up a little bit of the difference between some of the medical services that are provided by Department of Human Services. In the nursing home long-term care, private pay and Medicaid are at the same rate by law, but in what we're talking about here, medical coverage under Medicaid, it's just tremendous amounts of cost shifting. If I was to not be so critical and think of a positive way to solve this problem, I would ask for some sort of a graduated, subsidized, premium-paying benefit for people who really need it. I don't think all people who are at 138% of poverty would need to have 100% of medical coverage. I think there could be a graduated scale. And the other thing, there's going to be a lot of people that request or make their attempt to qualify for this program. If their income is at 160 or 170%, they'll try to get down to the 138%. I mean, it's a reasonable thing to do, and we're going to see more of that. So I guess I just anticipate more problems than solutions from this bill, and I would urge a no vote.
Senator Axness.
Well, Mr. President, I'm standing in support of the passage of House Bill 1362. And there are many reasons why I support Medicaid expansion, and most of them were laid out by the carrier of the bill, the good senator from District 13. But there was a story this body heard last Wednesday that made it abundantly clear why this is necessary. And that story was told by the good senator of District 32, and about a bond that he and a child he met a few years ago. And that bond, as the story went, was about providing Medicaid coverage for a child that had previously lost health insurance coverage through the private system. And because of this state's action and the Medicaid that child received, that child had exceeded her life expectancy because of the disease that she was born with. So ladies and gentlemen, I ask, if we were willing to do that years ago for a child, why would we not be willing to do that for over 20,000 North Dakotans who are currently ineligible for insurance? And furthermore, we're talking about debt and federal debt and deficit. Not once have I heard that argument used when we've been taking millions of dollars for road repairs, or when we've repeatedly gone and appealed to FEMA to ask for more money to help in emergency assistance when this state has had the money to step up and do some more of its own. Providing health insurance is not the vehicle to send the message that we've had enough with the spending in Washington. This is about people, and we need to start putting people above politics. So I urge the passage of House Bill 1362.
Any further discussion? Senator City.
Mr. President, we must honestly ask ourselves, why are so many other states refusing Medicaid expansion? And it's because there are so many serious concerns and unknowns about where federal health care policy is headed. Expanding Medicaid will cost the taxpayers of North Dakota hundreds of millions of dollars. And with this vote, each legislator who votes yes will be committing current and future North Dakota taxpayers to billions of dollars in new state and federal taxes. Each legislator who votes yes will be complicit in this nation's spending problem. And it's a very serious spending problem. Let's remember the federal government is broke. So broke that it is struggling to keep the Painted Canyon overlook open. So broke that it cannot make its lease payments in western North Dakota. So broke that 40 cents out of every dollar that we spend is borrowed. And much of that money is borrowed from foreign nations. This money will have to be repaid by our children and grandchildren. It is immoral to grant benefits today that can't be sustained and that must be repaid by future generations. It's not free money from the federal government. It's our money. It's the hard-earned money of middle Americans who are struggling to make ends meet and to pay their taxes in the next week. Eventually, the bill is going to come due, and the taxpayers of this state will be exposed to huge financial obligations to continue funding this free health care. According to the Centers for Disease Control, between 2000 and 2010, people on Medicaid were more than twice as likely to seek care in an emergency room than people who were uninsured or people with private insurance. So we're expanding a population that has been proven to seek care at the highest cost. Will this program really cut costs, or will it make healthcare costs escalate? If there's a glut of people in the emergency rooms, will those who really need emergency services be seen in a timely manner? I have a daughter in a state in the southeast who had to take her roommate to the emergency room and sit there for 8 hours before they could finally be seen. Medicaid is a broken system where the reimbursements don't match the cost. As a result, the costs are shifted to those with private insurance. A 2008 study estimated the average American family with private health insurance paid $1,800 extra because of Medicaid and Medicare underpayments to providers. Medicaid recipients are already having trouble finding physicians willing to accept new patients on the program. A dramatic increase in Medicaid patients will mean longer wait times for everyone seeking medical care. This issue is far from finished at the federal level. There are growing calls in Congress to limit or eliminate the ability to assess a provider tax. If the tax is eliminated, the states will be left holding the bill. And if the federal reimbursement rate for the newly eligible enrollees ever falls below 80%, the states are automatically allowed to discontinue the Medicaid expansion, they tell us. But can you imagine the firestorm, as the good senator spoke of in 2017, if we would decide to cut thousands of people who had become dependent on free government health care off the system? It would never happen. Look no further than Canada to find limits and rationing and long waits for medical help. Just last month, the Journal of the American Medical Association was talking about predicting 10-year mortality in older Americans as a way to determine whether or not certain tests and procedures would be worth the investment. I just sent you a synopsis of the article. The free money will come with many societal costs that we cannot begin to calculate. If the government says you only have 10 years left to live, therefore you can't have a colon screening. Medicaid expansion is not a panacea for providing health care to our citizens. It comes with serious risks and opens a Pandora's box of issues. There's no rush to pass this bill this session because the state may opt into the system at any time. It would be so much wiser to wait and see how it plays out in the other states. North Dakota has a fine medical system. If we surrender to government-run health care, the doctors will be told what to do and how to treat, and that's a slippery slope. The public does not want socialized medicine, but the special interests do. Ask yourself, whom do you serve? Make no mistake about it, the vote for Medicaid expansion is a vote to implement Obamacare in North Dakota. Is providing health care really a legitimate role of government? This nation's founders would say no. Someone just told me a few days ago that when the history of the demise of the United States is written, one word will summarize what doomed us: debt. Our national debt threatens our national security as well as vital programs. Social Security, Medicare, and Medicaid are already fiscally unsustainable and must be reformed. How can we vote to expand Medicaid and plunge ourselves deeper in debt when we can't pay what we already owe? The Supreme Court gave the states the ability to opt out of this expansion, and because the court wisely understood the financial burden that it would be placing on the states. Free markets work. The free market in healthcare has allowed us to have the best healthcare system of any nation in the world. Freedom and free markets lead to prosperity and growth. Socialism keeps people down, removes their incentive to work, and keeps them dependent. It ultimately leads to failure. Free markets preserve liberty. Socialism leads to despair. Thomas Jefferson said it well. I prefer the tumult of liberty to the quiet of servitude. And I urge you to vote no.
Senator Larson.
Oh, Mr. President, there's a few things that I want to just remind the body here, is that 100% of this is going to be paid, and there was a fiscal note of $150 million if we're doing it the way that the bill talks about. If we don't do it the way the bill talks about, it's going to be 300 and some million. It'll be over 300 million that we have to bring up the cost of. So another 150 million that North Dakotans will have to pay for that. So I hope we can resist losing that. The hospitals, they're talking about the unmet need. In my district, our hospital has $37 million that they're trying to cover that they feel that they can get back with this Medicaid expansion. And that's just the loss of the Medicaid expansion. That's not the Medicare and some of the other losses that they're incurring. Regardless if we vote yes or no on this, we are going to continue to pay that federal tax. Now, my girl and my wife go to the suntan thing, and they got to pay 10% on that, and that seems like, oh, that's not that much of a tax. There are 16 taxes that North Dakotans are going to pay regardless if we pass this or not. So if we go fill up our car at the gas station, and we decide not to take federal money for highway funds and that kind of stuff, and we're proud about that because we're from North Dakota and we can live without it, that money that we're paying on that federal tax is still going to the federal government. So we're still sending those taxes to the federal government where North Dakota is not getting those taxes. I was part of the group last session that resisted in allowing us to do it our own way and said, we'll let the feds do it. Now the feds are running the show now. So in that policy that a person has to have with this federal mandate, there's 10 items that have to be looked at in their premium. Now when you give a premium to a single person, a single policy, with just the essentials, that's maybe about $60. But with what the federal expansion that we went under, because we decided not to do it our way, we have to give them 10 caveats to be an essential plan for the bronze or the platinum, but the essential one, that's got 10 caveats in it. So if I was to give a premium to a single person with those 10 caveats instead of $60 trying to do it our way, now the federal government is telling us you have to give them a Cadillac plan. That's what we have to do, and that's what we're stuck with. We do have the time frame to get out of this situation, and some of the I heard a good idea, graduated scale and all of that. I think we all need to come together in this window of opportunity and take advantage of being able to say, we now know how to get out of it and do it our way. So I just encourage everybody to, bite the bullet on this one, and we have to go along with the committee recommendations.
Senator Campbell.
Mr. President, just a short question for the carrier. What will, if this bill is defeated, what would be the approximate cost of our state the first year, second year, and third year?
Senator Judy Lee, do you wish to answer the question?
If the bill is defeated and we don't provide any expansion in coverage, what we'll have is all of those costs to employers and employees, and I don't have the details in my head. I do have them in my folder. That doesn't answer your question right this minute. But as employers, you will be spending up to $3,000 per employee if you hire more than 50 people, if you aren't providing health care coverage. If you're an employee or an individual who is not providing yourself with health insurance, you will pay penalties of up to $2,000 per individual. These penalties are not deductible as health care provided by an employer would be deductible. So there are significant individual costs in that regard. The state wouldn't be paying, if the state paid for the expansion of Medicaid, 100% federal funds or 100% state funds, it would be exactly the same number as what you see under the federal funds now on the fiscal note. So, but what this bill is going to do is expand the coverage. If we kill it, we're not expanding the coverage. I did want to clarify one thing, if I may, before I do get my turn to talk, and that is that on the schedule for today, the vote is not accurate. The Appropriations Committee voted 7-6 to send this out, and the Human Services Committee sent it out 4-1. So I just did want to clarify that.
Senator Mathern.
Thank you, Mr. President. I just wanted to comment on 3 items noted by the senator from District 35. She noted debt, emergency room use, and socialism. I think it's important that we clarify that there's a broader way of looking at this. Debt. This portion of federal health care reform is part of a much larger portion. This is actually a very small piece. And in that larger portion, this is scored by the Congressional Budget Office as, in fact, saving money. So you have to look at it from the broader perspective over the 10 years. So this does address the question of American debt. Secondly, the issue of emergency room use. Emergency room use goes up for people who are not insured, for people who don't have access to clinic appointments and regular well child or personal development care, or looking at what are preventable kinds of conditions. They use emergency rooms. There is proof that there is less emergency room use by these people who would now be covered by this kind of program. The issue of socialism. It's a hot word. This is not socialism. The bill, as the Human Service Committee brought forward, does not direct us to employ doctors or to build hospitals or to employ nurses. Socialism is where you do all of that. The bill that we have before us is, one, directing the state to look at the options, including contracting with an insurance company, having these people go to the exchange. In all of those options, doctors are still private. Hospitals are still private. The system is in the private sector. So I think it's important that that perspective be addressed here, and that we move forward in passing 1362.
Senator Judy Lee.
Mr. President, just a couple more points that I wanted to clarify. And we are not going to be reducing the budget by a nickel if we don't pass this, because the taxes will still be paid by every citizen of North Dakota who pays taxes. We will continue to pay all of these 18 taxes, and the drop in the bucket that North Dakota is getting back compared to what's going on in the federal level, I don't think is going to make a significant difference in our deficit, which troubles all of us, the deficit, I mean. The premiums that we are currently paying, I don't recall if I mentioned this earlier or not, but it's about $100 a month that we are now paying in order to take care of that cost shifting that was brought up a little bit earlier. And one other thing in response to the question from the senator from Grafton, I neglected to mention, in addition to the additional costs for employers and employees, as has been mentioned, but I wanted to just add one more twist to this. Healthcare providers not only will be receiving lower reimbursements for providing care, but they are going to continue to have the same amount, at least, of uncompensated care being provided to people who don't have any health care coverage. So they will be required to do the same or more with less funds than they had before. This is a big deal to the 6 big hospitals, but it's a really, really big deal to the small critical access hospitals throughout North Dakota, particularly those that are the disproportionate share hospitals, DISH payments you may hear us talk about in the Human Services acronym dictionary. Those are the hospitals that serve a higher than average percentage of individuals who are receiving Medicaid or Medicare coverage. They come back to us every session trying to stay alive so they can provide medical services to the folks in their neighborhoods. And they will also be doing the same or more with less. And they've already got about one nostril above water. We need to help them at least get both of them before they can really start to swim. And I think that's really important too. If you look at the way this expansion is going to be implemented, you will note that it is going to be done by contracting with private carriers or using those private insurance programs that would be available through the exchange. So as has been previously mentioned, this is not going to be a government health program. I think that what we all need to remember is something that was stated more than once by our friend, the former senator from District 46. And he would say, when somebody criticized the amount of money in the Human Services budget, he said, okay, when you take care of everybody in your family from the day they're born until the day they die, and when you also take people into your home and you take care of them from the day they're born until the day they die, who have no one to care for them, then we won't need a Human Services budget. Until then, we have a moral and ethical obligation to provide the proper services and appropriate services to the people who need them most. And I believe this fits that definition. So please vote yes on House Bill 1362.
Senator Berry.
Well, Mr. President, the record is very clear over time that such projections that we make from the Congressional Budget Office and other financial assessors in Washington, the record is very poor on long-term and long-range programs. As it relates to things such as Medicare and the like, these numbers have been very wrong. And I have no doubt that down the road, the numbers that we're discussing today will be very different than what we're hearing. We tend to make assumptions on future behavior based on the way things are today, and yet when the rules change, so does behavior, and different things come into play. Therefore, I don't pretend to know what things will look like 10 years from now. I don't think any of us do. So the numbers that we talk about today and that we argue over and discuss, albeit important, I don't think they'll be the same. I have no doubt that 10 years from now, my tax burden will be higher than it is today. I have no doubt that our national debt will be higher than it is today unless there's a balanced budget amendment. I think that's just human nature. That doesn't change the fact that I have felt for 25 years in practicing medicine that we need to do something as it relates to the delivery of health care in this country, as far as the accessibility and the affordability as it relates to the people that we care for. I've had an opportunity to treat many different patients from all walks of life, large cities, small towns, different ethnicities, different races. And the reality is, we're all pretty much the same. We require those same things. As much as I may not like a lot of what this particular piece of legislation has to offer, it is the way it is. And I think the most positive thing I can say about the Affordable Care Act is that it has forced us to have a discussion in this country as it relates to health care in this country. Not only the responsibility of the government, but the responsibility of the people. What responsibility we have to look over our own health and to make a difference in that matter. So based on all of those things, this is a bill that I will, with holding my nose, vote for, as there are many things in it that I don't like. But I do think it will open that conversation, and it can be reevaluated as we move forward.
Any further discussion on House Bill 1362, final passage? Senator Wansek.
Mr. President, regardless of how you feel on this issue, one other area of concern, in my opinion, my commentary would be on the future of our health care, and I base that on a personal experience that stunned me in a sense. My son recently, a couple weeks ago, got engaged to a very fine young lady. She's finishing her third year of medical school in Wisconsin, and she said to me, based on everything that's happening, she's really questioning her life's path, the choice she made, and thinking that maybe she should have made another choice. Now, that stunned me and really saddened me to think that this whole situation is causing some of our young potential doctors to think twice about going into that area. And it doesn't really probably address this issue. It just maybe is another comment of disappointment and frustration with the whole issue.
Is there any further discussion? Hearing none, the question is on the final passage of House Bill 1362. Would the Secretary please open the key? All senators have voted. Any senator wishing to change their vote? Secretary, close the key. Final tally on House Bill 1362 reveals 33 senators voting yea, 14 senators voting nay. The bill is passed. Senator Klein.